Okay, and good day, and thank you for coming. Today is our foundation building day, so we'll be building up the spine, making sure the spine is strong and healthy, and helping prevent injuries. We'll work on plantar fascia and rotator cuff series. We always start with a bit of soft tissue work, addressing particular areas that are common to all of us that become quite sensitive and tight and sore. We're going to start massaging out the pecs, so the chest muscles, and the best way to do that is in a door frame or in a corner of the wall. And if you could have, so you'll just be massaging below the collarbone here around the chest and the pecs. And always the head should be turned away from the ball. You can do this against the wall if you don't have a door frame, but it's a bit more awkward for your neck. But you don't want to strain your neck, so just have your head angled down. Okay, and then if you're able to bring the arm up a little higher like that, and you can go across the tendons of the pecs, if that's comfortable for you, right around the head of the humerus. Okay, and now we'll switch to the other side. The arm here should be facing the wall, the palm of the hand facing forward, and head angled down a bit. Okay, and then bring the arm up if you can do that, and across around the edge of the humerus. Right by the underarm. Okay, and next we'll do just a couple of things on the floor. The upper trapezius muscle up here at the base of the neck, and then across the upper trapezius, and then down along the edge of the shoulder blade, between the shoulder blade and spine. And then we'll work here around the femur, so around the outside the head of the femur, and then we'll turn toward the back, around the glutes, and then up like this. The sacrum is a bony structure right here. Then we'll go up here along the sacrum. And I'm just going to move the camera down. You'll need to just go to the floor, and we'll be using the ball. And when we're on the floor, I always like to attend to the skull angle as well, the base of the skull, the suboccipital muscles. So we'll start with that. I hope this angle is okay. Okay, so first we'll just put the ball here along the base of the skull, and you don't really have to move the head around a lot. And I would hold on to the ball with your hand. If you can't get your head in that angle, then you can put the ball on a book. And you can just put pressure along the base of the skull in different places. If it's comfortable, you can massage around or even a little more into the neck. We'll do this a bit quickly on your own. You might spend more time. Now the other side along the base of the skull. And you can hold or go a bit side to side. Okay, then next, right at the left side here, right at the base of the neck, at the upper trapezius, and the levator scapula muscles. Okay, so we'll go across fiber, and then horizontally, like across between the neck and the shoulder. And if it's very tight and sore, you can just hold it and hold pressure. If it feels like like a thick piece of concrete, you can just hold the ball there to help release it a little, get some flow of the fluids into the tissues. Okay, then down along the edge of the shoulder blade. If this is too awkward for you, you can stand with your back to the wall and put the ball in a sock and just kind of massage out between the shoulder blade and the spine. But most importantly, make sure you go down along the edge of the shoulder blade. And if you have the arm up, that helps to expose the subscapularis underneath the shoulder blade. Okay, and then we'll switch to the other side. So here on the right side, just at the base of the neck. And you can bring that arm up. When you bring your arm up, it releases the tension a bit, and then it allows you to get deeper into the tissues. Okay, and then across the upper traps. Some days it might feel a bit more crunchy or hard or a little bit softer some days, depending on what you've been up to. And then down along the edge of the shoulder blade. And here you can again just hold if it's a bit sensitive, or you can move around a little more. And down in the middle traps, and then in the lower trapezius at the bottom part of the shoulder blade. Okay, and so next we'll work on the glutes. So I do have a specific approach I'd like to use here. So if you lift the left hip up a little, you're just lying down comfortably, and you put the ball on at the outer side of the hip a bit, and then straighten the left leg and just tip the hips up so that you're kind of comfortable. You're not getting tension and pressure into your shoulders. So first, the top of your leg bone, the femur, we want to move the ball around the head of the femur. And that's right in the socket of your hip, the acetabulum. And we'll move the ball around. And if it's sore, just hold. And then move the ball a bit more and hold wherever it feels like it needs attention. Turn toward the back, now beside the tailbone. And here in this kind of 45-degree angle, often the glutes get a bit sticky. Okay, and then the sacrum, so that's like up here, you can feel that bony wedge. And the piriformis muscle attaches here to the sacrum. And if the piriformis is very tight, it can pinch the sciatic nerve. So doing this often relieves sciatica, and it will help prevent sciatica from building up. So here you gradually work your way up vertically along the sacrum, and you can hold again. And then right here is like the top of the sacrum where the iliac crest meet the pelvic bone, and you like to get right into that corner. It's like in your house, the dust builds up in the corner, the connective tissues will get sticky in those corners. Okay, and then we'll work our way out along the edge of the iliac crest and where your glute tendons attach, and you'll feel some places it'll be a bit sore, a little bit tight, and you want to just work that out a little. Okay, and now directly on the side, so there's like a curve of the pelvis up here. And here, if it's very sensitive again, you can just hold on to it. It might radiate down your leg. So you're clearing your nerves as well as improving the blood flow, releasing the tension. Okay, now we'll start on the other side, right side, so just at the other edge of the hip. And then we'll go first around the femur. And it's quite common, I find people, the right hip, if you've been doing more gardening and walking and hiking and things like that, or long drives, yep, long drive for sure. Often the right hip will be a bit sore. Okay, and then now beside the tailbone. And now we'll go up along the edge of the sacrum to clear the piriformis, the sciatic nerve. Okay, and keep going up a little higher, and you might just hold. And a little higher, or you can, roll around in the glutes, of course, that's also fine, whatever you like to do. And a little higher. And mostly here we're working along the attachments of the tendons to the bony structures. Okay, and then now on the iliac crest toward the side of the hip. Okay, and the outside of the hip. And one more thing that I like to attend to is the jaw. Many of us grind our jaw, clench the jaw, tension and stress, and even the angle of sitting with our head position will cause the TMJ to be implicated. So to do that, the position is like this. If you have your mouth closed and press your fingers up, and you can feel there's a kind of a divot. You can feel the joints, the TMJ joints, and open all the way and keep the fingers, and you want to press right up into that joint with your fingers to release the pterygoid muscle. The best way, if you put the ball behind the head like this, keep your chin angled down. So you have your mouth closed, press your fingers up into, it's just like inside of the earlobes, and you press into your face and your cheeks, and you'll feel where your TMJ joint is, and then open all the way and hold and push up into the joint with your fingers. Okay, halfway closed. It can be very, very sensitive. And ideally it's even on both sides. If it isn't, it's okay to put extra pressure on that side that feels more sensitive. Okay, close all the way and keep the pressure. Okay, and then if you could just, your lower jaw, just move the lower jaw side to side comfortably. That'll help mobilize your TMJ joint. Okay, and then just relax the shoulders, and we'll nod a couple of times. And take a comfortable breath. And just nod a few times. And a comfortable breath. Okay, and only the eyes look up and down. And as you do that, it releases the suboccipital muscles in the back of your neck. And take a deep breath. And eyes up and down once more. And a breath. Okay, so we'll put the ball aside, and that's all we're going to do for the soft tissue. If you would like to do a more thorough set of soft tissue series, I have another video for that. But now we're going to start with the feet. So you can either sit in a chair or on the floor. First, we're just going to do kind of toe scrunches. If you're sitting on the floor, your feet should, or your hands should be pointing to the side, not back like that. To the side, and sit up tall, like have your chest out. Don't let yourself slouch into the rotator cuff like this. So first is just you squeeze the toes and spread the toes. Squeeze the toes, spread the toes. So scrunch and spread. Here we're just getting circulation into your feet. Try not to move your ankles right now, just the feet, just the toes. Just toes, not ankles. And spread them all. See if you can get all of them to separate. Okay, then next is like this, forward and back. Flexing, extending the ankles. Okay, now we'll just do ankle circles. And other direction, ankle circle. Great. So now individual toes. So if you can't sit on the floor, you can try like this, sit in a chair, and just even you move one toe like this. But best is if you can hold on to the toes, and you take one toe, the big toe and the next toe, and then bend them relative to each other. And hold on to the toe knuckles, so you're not bending the toe knuckles, you're bending right at the attachment to the foot. The next two toes. And if this is the first time you're doing it, the skin is often very sensitive, but it will become more pliable with practice. Next two toes. And next two toes. Try to separate them from each other, move them independently. Okay, and next, other foot. Big toe, next toe. Okay, next two toes. And hold that second toe knuckle firm so you're not bending the toe knuckles, but you're bending at the attachment to the foot. Next two toes. Good for your hands too, right? We need to keep our fingers and toes moving. The other two, last two toes. All right, so from here, we're going to stand up. You might need to do this in a chair though, if you need to hold on to your toes. So we're going to go like this, big toe down, other toes up, and then other toes down, big toe up. But you might need to hold on like that to the toes to help facilitate that action. So if you can do standing, that's fine, or you can sit in a chair and just hold on to your toes. So this is part of, plantar fascia to get our feet and ankles working better. Okay, so first, you do it at your pace, but big toes down, other toes up, other toes down, big toes up. Okay, and then we're going to just do a rocking action. So you like this, rock side to side. And integrate the toes with it. And that rocking action is from the ankles. So you're not twisting your knees or your hips or your waist. Okay, and then next we'll just go forward and back. And as you do that, it's heel outside the foot, baby toe to big toe. On the way back down, big toe to baby toe. Okay, and then just gently bouncing. So you're like this, just a bit of a bounce. Okay, and then we'll just practice walking since we're here with the video. So you go heel, baby toe to big toe, heel, baby toe to big toe. And as you do that, try not to roll the ankle. So it's not your ankle, it's more from the forefoot that you can go. Don't worry, we're going to work on building that pattern over time. But that's the idea. Okay, so next we're going to do a few stretches for the feet and toes. And here you'll need, okay, so you can use a ball, just massage out with a ball, a rolled up towel. This is called a soulmate. It's just a cork structure. And this is called a toe pro. So any of these things can work, or even just a rolled up towel. So this is called a toe pro. This is the design. You can use the toe pro or the soulmate. But to start out, we're going to do a massage. So for this, you can use a ball, like just any kind of tennis ball like we did earlier. Or if you have a massage ball. So I'm just going to use this, or a rock, or like if you use stones are really good, that you just want to massage out like that. The feet. Maybe this angle is better. Okay, so you just want to work into all of the arches of your foot, the outside arch, the anterior arch here, the transverse arch, and the middle. And if you can, I like this because you can really stand on it and you can get really good pressure into your feet. But it's really important to get into this forefoot part. And also, if you're right here on the outside of the foot, there's an arch right there, or there should be, where we have the most proprioceptors in our body, actually. Okay, so next we're going to do a couple of stretches. So again, you can use your rolled up towel or the toe pro. First the toes, so you have the foot just like this, only toes up, foot down, step forward and back a couple of times, and then just step forward and bend the toes and hold. If your toes, are very, very stiff, don't worry if you can't even lift your foot up. Like, just start trying to bend the toes. I mean, that's really critical for your whole body. If your toes are stiff, the rest of your body will not be able to function optimally. Okay, other foot. So just toes up, and you'll note the benefit here too is you spread the toes apart from each other. Step forward and back a couple of times, and then just bend the toes. And if the big toe, so many people, the big toe, will be quite sore. So just do some pressure, but what you can tolerate. it is important to keep that joint bending and help prevent the bunions from building or getting worse. Okay, so next the calves. So this time, again, you can use the toe pro and you would have the foot up like this, heel down, foot up. Or you can use the soulmate. I like to double it here. Or you have your foot up on the towel, but heel down this time and foot up, and then you go forward and back. And then take the front foot, step around like this. So you're stretching, you should feel stretch in your calf, obviously, around the ankle. And we're just holding. On your own, you can, again, spend more time. Okay, and then step around again. Okay, and the other foot. So forward and back a bit. And then step around. Keep the back leg straight when you're doing the stretch. So the knee should not be bent. And stand really tall here. Keep the big toe pressing, but you can think of kind of lifting the arch. Okay, then we'll unwind. Good. So next we'll just do I'll just show here if you do the soulmate, you'll have both feet up like this, like the toes are on it. The forefoot is on it like this. Okay, and then we're going to do a balance exercise. If you don't have that, you can try on the towel or just on the floor. So now we're going to integrate our hips. We've just worked on the feet and the ankles with the plantar fascia. And we'd like to integrate now the connection of our hips along with the feet. So here, if you have the soulmate, you'll have the feet up. And you do a bit of a hip hinge like this. And then lift the heels and hold. And if you don't have the soulmate, you can just have your feet on the floor. You do a little hip hinge. And then lift the heels up and hold on the toes. All right, good. So a couple more things. If you have, or if you want to, a rolled up sock or a hacky sack. So I have this hacky sack thing, and you can just use up a sock, or you just slide your toes. So we're going to go first forward and back, and you can just have your toes like this on the floor. The important component here is the moving leg. There's no load onto that leg. All the load is on the supportive leg. So now I'm going to stand on the left foot, and the right foot, you slide the toes forward and slide the toes back into your lunge. But the body weight is always completely on the left foot, on the left leg. So really critical here is you're using the glutes. And that left knee is pointing forward always. Don't let that knee dive in. Okay, now we'll switch. Right foot supporting. Okay, so left foot forward and back. The toes are sliding on the floor, but the body weight is always on the right foot. Keep the knee centered and think of using the glutes. Okay, and now we're going across. So this time the foot goes behind and to the side. So at the side, you see the feet are side by side. The leg doesn't go back like that. It's really critical that you're always square. That would twist your knee. So we'll start left foot supporting. Right foot goes cross behind, then out to the side. And always the body weight is completely on the left foot, on the left leg. Left knee is not diving in. Left knee is centered. Okay, switch. Right foot supporting. Okay, left foot, you go cross behind. Then out to the left. Keeping the body weight on the right leg. Good. Okay, so at this point, if you would like to wear toe spacers, I do, because now we've just opened our toes up. You really strengthen them if you would like to do that. If you don't have toe spacers or you don't want to, then for now, if you could please do this, because we're going to be starting shoulder and spine exercises, that you just do a bit of this kind of cat-cow maneuver, rounding the spine, arching the spine, very gently, not forcing end range. And of course, many people do this cat-cow type maneuver just to help floss the spine. It's not to stretch the spine so much. It's more to just loosen up the vertebrae, get better flow of the fluids along the spinal column. In the morning, our spines are stiff, our backs are stiff because the fluid builds up. And that gentle action will help the fluid to flow. Okay, now the next part of our training today is the shoulder series. So I'll just quickly describe, there are 4 main rotator cuff muscles. So we're going to attend 3 exercises to attend to those different angles. The first one is external rotation. This is external rotation or external rotation. The main 2 muscles, infraspinatus, like under here, and teres minor. The position is standing against the wall like this. So you stand with your side to the wall. Be careful of pulling the elbow too far behind you. If you go like that, you see your arm goes forward. So your elbow is just like this by your side. It shouldn't be back because you don't want the head of the humerus to drift forward. So you're just at the wall like this. I like to start with left side. So you have the left elbow on the wall, the form 90-degree angle, stand really tall and press the back of the wrist into the wall. So the back of the left wrist you're pressing and you stand really upright. We're holding the positions for 10 seconds. We're going to go through the series twice. Okay, turn around. So now you have right side to the wall, your elbow by the side. Make sure you're square forward. Keep the chin back and press the wrist, the back of the wrist. You'll feel the counterbalance from the left leg too. So you also get the benefit of the diagonal vector alignment. Okay, so that's for this external rotation pattern. The next muscle, so up here is upper trapezius, and below the upper trapezius is called the supraspinatus. The supraspinatus is right above the shoulder blade, and it helps to stabilize the shoulder blade, prevent the shoulder blade from going up. And in our society, a lot of us are like this, right? And the upper traps are very dominant. So when people, instead of using core, use upper traps. So we want to strengthen supraspinatus. The angle is, you need something like a shelf, okay? Like the kitchen cupboard is really good, a bookshelf is really good. Ideally, your arm is like this at shoulder height, and the arm is start here 0 degrees, and then you take the arm out at a 20-degree angle and you push up into the shelf. That's what you want to feel like. Like I don't have a shelf, so I'm going to just do this. I have this kind of a J hook on the wall, but it would be better to have a bookshelf. Okay, so I'm using this J hook, but imagine I'm in a bookshelf. So I'm at a 20-degree angle, and then you push up with the back of the wrist. Keep the shoulder down from your ear as you do that, and you're pushing up. And in that position, you'll strengthen the supraspinatus without activating the upper trapezius. That's our goal. Okay, then right arm. Okay, so your 20-degree angle, chin in, square forward, and press up with back of wrist. Keep shoulder down. Okay, that was supraspinatus. Now the 4th rotator cuff muscle is called the subscapularis. And the subscap is, so here you have shoulder blades, right? The shoulder blades, they sit on your back like that. So there's rib cage and shoulder blade. the subscapularis keeps the shoulder blade on the rib cage. So when you're moving your arm like this, up and down or side to side, the shoulder blade should be moving on the rib cage like this. And what often happens is when the subscap is weak, the shoulder blade lifts away from the rib cage and moves like that instead of like this. So we want to strengthen the subscap. So we're going to, oh, this is what it looks like. So you stand at the wall with your back to the wall. You don't have to push into the wall, but your back is to the wall and your hand is just like this, like in the back pocket. And you press your hand in toward the wall. Okay, so we're going to go back over here to the wall. Go back to the wall. And then have left hand kind of in the back pocket. The palm of your hand is facing the wall. I'm standing right against the wall, but not pushing into the wall with my body, but push your hand into the wall. Okay, and hold. So this position will help to strengthen the subscap and prevent the shoulder blades from winging and going up. Okay, switch to the other arm. And if you can't get your hand behind your back, you can just start going in that direction. Like you might have it just on your hip for now, and then maybe by the side, and then someday you'll get it behind your back. If you've had tears in your rotator cuff or frozen shoulder, I mean, these are ideal exercises to help prevent shoulder injuries and also to deal with them if you had them. Okay, and now just because of time, typically you should go through that 4 times, but we're going to next transition to our spine strengthening series. So again, the rotator cuff series is exactly what we did. And ideally you go through that cycle, those 3 exercises 4 times, 10-second holds each position. Okay, so now if the best thing for the spine strengthening work is if you have a stability ball or an Ottoman. I like the Ottoman a lot because I find people are more stable on the Ottoman than on the ball. And you don't want to be wobbling around here when we go through this series. Okay, I have to set up a couple of things. So if you have a stability ball or Ottoman, if you could get that set up, because we'll be lying down on it. And there's also a bird dog variation, but today I'm going to demonstrate only the Ottoman version. And there's another option that you can do on a bench or a bed. There are 4 different positions. The first one we'll be doing is a torso lift. It's like a Superman type of lift. So here's my Ottoman. And again, each position we're going to be doing 2 10-second holds. Torso lift is number 1. So you lie down like this with your abdomen supported and the lower back supported. With each position, even though your abs are supported, you should be thinking that you need to engage your abs. So you're lying down like this, right? But you don't want your back to hyperextend. So your abs should be engaged to give muscular support for the abdominal cavity. The feet are on the floor, hands at lower back, chin in. Your hands up like this, lower back, and then keep the chin though pulled in, don't let your head drop. So when you go down, you're just a little bit down, not taking the load off. And when you lift, don't hyperextend the lower back, you just lift a bit so that you feel there's a brace in your lower back. Not that you're going up really high to cramp up your lower back. That's not a good thing to do. Okay, then release. Then again, you brace your abs, brace your lower back, and lift a bit, keeping the chin in, and hold. Okay, and lower. Okay, second exercise is a leg lift, double leg lift. So you need to go a little bit forward, have the hands like a push-up position. If if it's too low, you can widen your hands or take the arms a little forward, but ideally elbows are straight, chin tucked in always. Brace the abs again, brace your lower back, engage the glutes, and then both legs lift and hold. So lower back would always feel like it's braced, but not cramping up. And then lower. And then again, chin in, braced abs, lower back, both legs lift and hold. And lower. But to get off, these transitions are really important, so I'm going to go through them. You walk the hands back, and then bring both elbows onto your ottoman, and then press like a plank to come up, so that you don't twist your knees when you're doing the transition. Okay, so next is a plank hold, kind of, or a push-up hold. I think it's more accurate. So here you can use a couch or a chair. It's like this kind of angle. And you can have, okay, you can be like this on your, like this type of plank position, or you can do like this on the fists, or you can have hands, whichever you prefer. But first you set the arms up, and then walk the feet back, and then hinge forward into your perfect push-up position. For sure your heels are off the floor, you're on the toes, and you're pressing your arms or your hands into the couch so that you feel your abs are engaged. Now keep the arms and legs straight, don't bend the elbows and knees, and you walk the toes forward like inchworm. And then rest. And the second time, so same angle. So here, if you want to, you can bend the elbows a little more. So I'm going to walk the feet back, set up into your good push-up position. If your hands are flat push-up position, then you can bend the elbows a little. So we're going to go gradually through different phases of a push-up hold. Is it better to do it on the floor? Straighten the arms, walk the toes forward. I would say generally for most people it's better to do this elevated than on the floor. Most often when you see people do push-ups on the floor, their necks are hyperextended, their backs are hyperextended, they're really not doing themselves a favor. The angle is more, for setting the shoulder girdle and abdominal strengthening, the elevated push-up is really good. Okay, lastly, number 4 exercise is again a shoulder external rotation pattern. You don't need a band, but you can do it with a band. But if you just bring the left arm by the side and then keep the elbow here as you externally rotate the shoulder, okay? And also don't bend the wrist back like that. It's not a wrist bending. The wrist should be very stiff. So here I have a band, the left hand holding on. You start with no tension and externally rotate, step back a little bit, so you have a little bit of tension, and then for our balance, left foot up. So this is our shoulder external rotation hold, and rest, and right hand, so start with elbow by the side, and again, you don't need the band, then you externally rotate, keeping the elbow by the side, keeping the wrist straight, step back a little, and right foot up, if you would like to do that to challenge your balance. Okay. Now we're going to go through this spine strengthening series 2 more times. I'm going to change the first one that I demonstrated, the torso lift. I would suggest you continue with that. There is another option that I like to do. This one is on the bed, and the chin is supported on the bed. The hands are at the lower back. And with this one, you lift the hands off the lower back and cross them over each other like that. You don't lift the legs, you don't lift the torso, your chin is down. So I would suggest most people do what we did earlier, the one on the ottoman where you do the torso lift. If you have this option of a bench or a bed, this is a little more challenging. Okay, so torso lift, ottoman, or bed group, the chin is supported. Everybody hands out low back. Ottoman group, torso lift, hold. The bed group, both arms lift and hold. And rest. Okay, again, torso lift or arm lift. And rest. Okay, and next is double leg lift. And if you would like to, so another variation that helps strengthen the piriformis. So this helps to strengthen your hip external rotators, is you take the legs to the side. So you're on the Ottoman. So you can do exactly what we did earlier. You have both legs lift up in the middle, or you can go like this. You take both legs to the side and rotate the feet out. But if you do this version, you must use the hips, the muscles on the outside of the hips. Make sure. Okay, and then rest. Okay, so legs up either in middle or take legs to the side and externally rotate the hips. And rest. Okay, then walk the hands back. And then come up on the elbows. So we don't twist our knees. Okay, and now the push-up hold. Okay, so you can choose your position. Hands or fists or elbows. Okay, everybody though, shoulders are down from the ears, chin tucked in, brace your abs and glutes. If you're doing your push-up hold, you might want to go down a little lower into your push-up position and hold. And straighten elbows. Keep the arms straight as you walk the toes forward. Okay. And second time. Set the hands, tuck the chin. Make sure you don't let your head sag down. Walk the feet back. Okay, so first shoulders down from the ears, press into your couch so you feel your abs. And at that point, if you want to, you can bend the elbows, keeping the control of the abs. And press. And walk the toes forward. Great. Okay, so shoulder external rotation. So if you want to use the band or not. I like to start with left arm. Okay, the elbow is by the side. And then externally rotate the shoulder, keeping the elbow at the side. Step back a little. Left leg up. Okay, foot down. Then right side. Elbow by the side. Externally rotate. Step back for a bit of extra tension and right foot up. And rest. Okay. And then back to the Ottoman, the torso lift. So we're going through that cycle one more time. Ottoman or the bed group. So Ottoman is the torso lift, hands at low back. Bed group. You don't lift the legs or the torso, you lift the arms off the low back. And rest. Okay, second time, the same thing. And rest. Okay, and now double leg lift. So this time again, you can just lift both legs up in the middle. If you're new to doing this, I would suggest doing that for some time, so that you become stronger before you try doing the wider leg position. But let's all first rep. Brace your abs and brace your glutes and lower back, then lift and hold both legs in middle. And rest. And then this time, if you want to, take the legs wider. Brace the abs, brace the low back, and legs either middle or wide. Externally rotate if you go wide. So that means toes angled out, but make sure you're using your glutes, the outsides of the hips. Piriformis. And middle, and down. Okay. Okay, and now the push-up hold. Okay, so whichever position you prefer. Make sure your abs are really engaged and chin in, and then bend elbows if you like. Okay, straighten arms and keep the arms and legs straight as you walk the toes forward. Okay, and second one. So you see I vary the position of the elbow bending each time. Okay, set the arms, feet back, set your good position. And walk the feet forward. Okay. And once more. The shoulder hold. Now, one more thing about this one. The most important thing you should feel is when you externally rotate this muscle here on the side ribs, the serratus anterior that holds the shoulder blade here on the side of the rib cage. So when you rotate out, you want to really feel here. Okay, not just around the shoulder, but here right on the side ribs. And left arm. Okay, elbow by the side, externally rotate. Step back a little. Left leg up, but focus on the serratus. You should feel that on the side ribs. Feel that muscle engaged. Okay, rest. Now that should happen automatically, but for most of us, we have to kind of think about that one. Okay, right elbow by the side, externally rotate, step back a bit. Engage the serratus. Right leg up, keep the side ribs engaged. Don't bend your wrist back. Okay, and rest. Okay, that was fantastic. So there's one more part of the spine that we didn't really attend to too much, and that's the neck, that cervical spine. And so to do that, I'm going to move the camera to the floor. We'll be just lying on the floor and doing a neck strengthening maneuver. Now, the critical thing is the head position. It's really difficult to get us to hold our heads in place, but so often when we put the chin, it's not like that, okay? It's horizontally. What we want is lengthening the spine in your neck. So the chin goes like this horizontally back, like this. And that makes the back of your neck straighter, right? Not like this. So the chin is back and in like this, not down. And then when you lift the head, so this, when people try and lift the head up, they go like that. So that should not happen. You should only lift your head if you can keep the chin in like this, and then you can lift the head like that. But not if you go like that, you've bypassed the muscles you're trying to strengthen. So it's really critical when you lift, head is like this. The breathing, okay, now this is a little more complex. To hold the jaw, the breathing is like this. You have a smile and when you do that action, you'll really feel like the vibration right down into the pelvic floor. So if you'd like to, it's lips like a smile and kind of like a humming action, exhale through the mouth. So if that's too hard to do, then forget the breathing part, just do the hold. And if it's too hard to lift your head, don't lift the head, just keep your head on the floor. The most only really important part here is the lengthening of the neck. And holding that position so that the cervical spine strengthens. Okay. So your hands can be on your abdomen like this, or if you can get them like that under the lower back. Right leg bent and left leg straight. All right, great. Be sure your head is centered. If you need a little pillow for your head, because your chin shouldn't be going up to the sky here. All right, so imagine a string attached at the top of your head, this common kind of yoga type term, but someone's going to pull that string to lengthen your spine and chin toward the throat. Don't press your lower back to the floor. Your back should have a slight arch. Okay, so lengthen the spine, chin is angled down in toward the, or chin is in, right, not going up. From here, if you can do it, you can lift the elbows a bit. And from there, if you can do it, you lift the head just a little. And then do the breath. And then relax. Lengthening the neck, chin in. If you can, lift elbows. If you can, lift head. And rest. Lengthen, chin in, elbows up. If you can, head. Okay, switch legs. Left leg up, right leg straight. We do that because it helps you to engage your rotational core. It stabilizes the abs better. Okay, lengthen, spine, chin in, elbows, head, breath. And rest. Lengthen, chin position, elbows, head. And rest. And again. Okay, rest. Switch legs. We're doing one more set the same. So think about this, right? Just lift your head. What happens? If you just lift your head, your chin goes up. That's forward head posture. So we want to train ourselves not to do that. Lengthen the spine. Someone's pulling you back from the top of the head. Chin is in, elbows up, head up. And rest. And if it's too strenuous, keep the head on the floor. Lengthen, chin, elbows, head. Rest. The sequence is critical. Lengthen, chin, elbows, head. Okay, good. Switch the legs. Last set. Reaching straight back from the top of the head, chin in, elbows up, head up. And rest. Again, lengthen, chin, elbows, head up. And rest, last one. Reaching straight back from the top of your head, chin down, elbows up, Head up. And then rest. All right, and so from here, just relax on the floor too. Best is if you can just lie down on the floor here for a couple of minutes. And if you can't, have a great day. Thank you very much for joining me today. Make the best of take good care of our bodies so we can stay in our homes and enjoy our beautiful lives. Enjoy the outdoors.